People with severe mental health disorders have a greater risk of dying from COVID-19. That's the result of a study done in Sweden. The results raise questions about whether this group should be given priority in receiving vaccines. The research shows for those older than the age of 60 with severe mental illness, deaths from COVID-19 were almost 4 times more likely. The study included people with schizophrenia and bipolar disorder, but didn't include those with depression and anxiety. It's unclear what causes higher rates of mortality in people with severe mental health disorders. Researchers suggest that the mental health problem may cause premature biological aging that may impair the immune system. This research may help guide state and local health departments in giving priority to the elderly who also have severe mental health issues. Until then, friends and family members should continue to use extra precautions when visiting this high-risk population. I'm Bill Prasad, your mental health and wellness expert.
Remember, you are not alone in this. If you're ready to talk, mental health professionals are always listening. The Harris Center and its crisis line is available 24/7. Call 713-970-7000 and select option 1. We also have more resources available on khou.com.